When a child is perfectly healthy or their version of normal healthy, and then everything changes and all of a sudden some really scary symptoms come on board. That is today's show, both on how to mitigate the risks of that happening as well as treatment and healing options. You'll know that if you listen to the show live, every month we have low-tox partners that help you with your swaps or stock-ups, depending on what you might need right now. Check out the Weleda and Oz Climate offers below. These two are for Aussie residents. Enjoy. Nancy, it is so good to see you. I am really thrilled to have you here and to do a show on not children's health in the broader sense, but some of the things that you are specifically specialized in, supporting families at the coalface where very little help has been able to be had for a long time. And I think, okay, I'm going to start here. You have your child. If everything seems fine, let's say, as they're born, we're not thinking at any point then in the back of our heads, oh, we've got to watch for PANS, PANDAS, BEG. Like, no one's thinking of these things until it hits you like a freight train. And that is just, I want to start by asking you about that moment, the moment a parent's life is turned upside down and possibly they see 10 people before they get to you. Let's be real.
Yeah.
So they're not arriving with much hope anymore often. How is that first consult for you with families that are experiencing these issues with their kids?
I always say the most important instrument in my office is a tissue box because just being heard and being told you're not crazy. I've been there. I've seen this hundreds of times. I've been there as a parent. I've been there as a professional. I get it. And those three words help them to just drop their shoulders a little bit because so many other people have been saying, your kid's crazy, or you're a bad parent, or even within their own family, even within their marriage. And this is a post-infectious or post-metabolic syndrome that something triggers in those susceptible children, a behavioral or neuropsychiatric change that can happen overnight. And you have a totally neurotypical child on February 12th, and on February 15th, they're on the floor having seizure-like tics, talking about intrusive thoughts or sexualized things or political things or religious things you've never heard come out of their mouth, or they're anxious out the yin yang and won't leave your side, or they're doing weird walking, or, just in a puddle on the floor. And any and all of those, or restrictive eating, that's the other one that's big, any or all of those could be this disease. And I just want to say you are not alone. This is treatable. It's challenging. But there is so much we can do. We just have to make one step forward.
And are you specifically talking about PANS and PANDAS when you say this disease?
Yes. Yes. And I want to include, because, that phrase or those phrases have become so kitschy, so like misunderstood. What we're talking about is post-infectious syndromes. So PANDAS is pediatric autoimmune neuropsychiatric disorder associated with strep. So after a child gets a strep infection or even exposed to strep, their brother may have a strep infection. They're not even showing any signs of strep, but their behavior goes berserk. That could be this disease. PANS, that phrase was coined in the 1990s by Sue Sweeto, one of my wonderful mentors. And in 2012, they tried to make it less controversial and included other illnesses like mycoplasma and tick-borne diseases like Lyme disease, which are in Australia, New Zealand, and everywhere in the world, by the way. If anybody thinks there isn't that in those places, and included viruses, but then also included mold and yeast and anesthesia and exposure to chemicals, pesticides, etc., other metabolic things. But it was always an abrupt change. PANS was pediatric, abrupt onset neuropsychiatric syndrome.
Mm-hmm.
Now, I have to say, that's where, by definition, we want to keep it because we want more practitioners to see it. And if you see this abrupt change, then we want to institute appropriate interventions, which are antimicrobials to the appropriate trigger, anti-inflammatories or things to support the immune system, and treating the symptoms, but not just treating the symptoms.
Mm-hmm.
We often get into one or the other. The conventional medicine docs are just there putting on the SSRIs or medications to treat the symptoms. And some of the functional medicine docs are just adding the herbs to treat the microbe, but not doing anything to treat the symptoms. So it's got to be that three legs of the stool.
Yeah, there's the like save the day and then the day-to-day, the long game. You
Yeah,
need both.
yeah, yeah,
Mm.
absolutely. And a couple of things sometimes in both, but not
Mm.
20 things. I also
Yeah,
hate
yeah.
when kids go into the office and you come back with this big basket and you're like, what? My kid won't even eat. So what's really important is that the three arms of the stool or legs of the stool, the three-pronged approach, I always call it. And
Mm-hmm.
treating the symptoms, yes, but not just treating the symptoms. Treating the underlying trigger. Was it strep? Was it mycoplasma? Was it Lyme? We use the right, or was it mold? You put a kid on an antibiotic and it was mold, that's going to make them worse. You
Mm.
got to be the detective to figure out the trigger. And then the biggest piece that both sides of the aisle sometimes forget about is that we have so many nutraceuticals, supplements, medications that we can use for inflammation and providing immune support, but it's got to be all three.
Yeah.
And I think that's where we miss it on either side of the street.
Right. Okay. So I want to unpack a few things. Let's
Yeah,
walk it back and talk things that we can be more aware of, and even age groups that we can be more specifically focused on
yeah,
prevention and proactivity. Like
yeah.
when,
We'll start
I
there.
mean, you
Yeah,
can't prevent a tick bite 100%. Like that's
right.
impossible. If your kid loves going into the forest and hiking and summer camps, like it's quite possible that they are going to get
Right.
bitten by a tick at some point. So the proactivity piece feels like it's fundamental
Yeah,
to possibly preventing a full situation. But even before we go there, you mentioned susceptible kids. So,
yeah,
can we actually
yeah,
start with who
yeah.
do we know is susceptible? What do we know about how we could know if our kid might be
Right,
susceptible?
right. Okay. So first of all, this disease or these diseases don't affect every child. Unless you
Mm,
come to my office, then it seems like everybody has it.
yeah.
But in general, in the literature, it's 1 in 200 kids.
Mm-hmm.
Those of us who are in the trenches think it's much more than that, and many, many are getting missed, and it's at least 1 in 100. But why don't 100 kids who get a strep infection get pandas? And it's
Mm,
because genetically, some children are susceptible. They may have HLA-B alleles that you can measure, HLA-B 32, 58, 38, that make them more susceptible to autoimmune disease. They
mm-hmm.
may have Th17 cells that make them more susceptible. But if you have a family with autoimmune disease, 64% of children with PANS and PANDAS have autoimmune disease in their family. So all of those children are more susceptible. You don't need a genetic test or some fancy test. If mom
Yeah, I was going to
has
ask. Mm,
autoimmune thyroiditis, dad has inflammatory bowel disease, grandpa had rheumatic fever, diabetes, whatever it may be, if there's autoimmune disease in the family, you have a very high percentage chance of, if you get one of these infections, rather than the antibodies, the part of the immune system that should attack the throat when you get a strep throat,
mm,
rather than attacking there, those antibodies cross the blood-brain barrier and attack a part of the brain called the basal ganglia. That's
mm,
why it's also called basal ganglia encephalitis. That
mm,
just means that part of the brain is inflamed, and that inflammation in the brain is causing the inflammation of the behaviors. That
mm-hmm.
inflamed, anxious, ticky, OCD, kind of kid.
Yeah. You mentioned a lot of kids get missed. Does that mean that we could be dealing with like a light presentation where neuroinflammation needs addressing and it hasn't been found?
Exactly. So
Mm.
when we see it missed a lot is when the children are very young. So
Hmm.
you get a 2-year-old whose older sibling is in school and that sibling gets strep, but the 2-year-old is only doing the terrible twos. You don't
Yeah.
even think about strep in the 2-year-old. The pediatrician may even look in the throat and see it looks normal and not even think about that. Or they may see something or an ear infection and they treat it appropriately and the behavior gets better and you think, oh, they just got through the terrible twos. But the behavior got better because they were put on an antibiotic or it was a virus, they got over the virus, and it was never picked up as being
Mm.
PANS or PANDAS.
So they could have got
This
put on an antibiotic just by chance for like an ear infection
exactly.
that they picked up.
Exactly. And
Wow.
then they get better. Nobody suspected anything. But what happens is if you don't recognize it, then the second time they get it, the third time, the fourth time, it builds on each time.
And it's
And the
because we didn't do
symptoms,
the three
yes,
stools at
yes,
the point of it happening
yeah,
because it wasn't major enough. You
right,
could rationalize it. That's what we
right,
often do, right? We think,
right.
terrible twos, or yeah, your father has ADHD as well, and so I guess it's going to be you too. And I'm
Right.
I have ADHD. I definitely believe the neurotype theory, but I also believe in the symptom exacerbation of the negatives aspect.
Exactly.
Yeah.
Exactly. And going back even farther, I think
Mm,
that we should think about this even in our babies. Not that
mm,
babies will get pandas, but that tendency toward inflammation and autoimmune disease.
mm,
So, first risk factor born by C-section rather than vaginally. They're not getting the mom's normal vaginal mucosa. You
mm,
have to deliver by C-section, do what we call a perineal picnic, where you take some gauze or your hand from your vaginal area and rub it all over the baby. Give the baby those germs they need. We also, oftentimes are adding more formula rather than breastfeeding. Breastfeeding, even in our toxic moms, is safer and better for our kids, and gives them that natural immunity, that colostrum that they need. But that early baby that starts to get eczema or starts to get colic, they're already showing you that their tendency is toward inflammation. And
mm.
so we need to go back. And where does that start? What's the first brain? It's not the brain, it's the gut.
Yeah.
So we got to go back to the gut. We got to get those good germs in there, that good food, and really feed that gut. And then the second thing, what are we doing, especially since COVID so much? We're indoors more. We're not commingling with other people as much. We're not getting outside,
Mm,
at least here in the United States.
yeah.
And I think that is the best form of biohacking. You hear
Yeah.
all about biohacking these days, but biohacking is really getting outside, being in the dirt, getting exposed to good air, breathing deeply, getting good sleep, pooping well, exercising, but really being outside. And
Mm.
and that's what these kids need as opposed to being isolated, either before, very early on in life or after they may get the first incidents. Those things are so vital.
So vital. And I think in bringing up COVID there and the get outside, I think there's a bit of victim mentality. Like we keep saying, oh yeah, COVID made us stay inside. It's like no one's making you stay inside right now. Get out there. We've got to rebuild that muscle.
Yeah.
You know,
Yeah.
I
And
think
so
like just those nature spaces, the parks, and I think we could even say in modern parks where they still treat with glyphosate in half of them, unfortunately, for weeds, it's still better to be outside on a nature walk than inside around all the VOCs of an indoor environment.
absolutely. Whatever it is, it's better. You
Mm.
know, I agree with you. Yes, if I had my own lawn, would I be putting glyphosates and Roundup and everything else on it? Absolutely not.
Yeah.
But if what I have is a park and there's some of that, I'd rather our kids be outside playing,
Mm.
mingling with other kids, not isolated, because we've seen since COVID, we are more susceptible to all of the viruses, all of the things. We're getting much more virulent episodes of strep infections, mycoplasma infections, other viruses. And part of it is because our immune systems have been depleted
Yeah.
by not being exposed on a routine basis. And
Mm. I
so we
remember
do
when we all,
need that exposure.
yeah, I remember when we all got back out there. We had some really long lockdowns here in Australia, and I likened it to what I was seeing around was like toddlers going to daycare for the first time and just everyone getting everything again.
Yes.
And I mean, that is actually a positive, right? As long as we have the tools to use it as an opportunity rather than get knocked down, which is what you're talking about. We don't want it to be straw that breaks the camel's back.
Exactly. And I'm not
Yeah.
saying to not wash your hands when
Yeah.
you're,
Yeah.
going into a public place and things like that, but
Mm,
don't not be exposed because you're afraid of how it will affect your immune system. Your
mm,
immune system needs the little bits of exposure in order to develop.
mm,
If it's barren, it will get much sicker.
mm,
And I understand, a lot of people may be saying, but I was told I should homeschool my child so they don't get sick, so they don't get another pandas infection. And I understand that. And some of our sickest kids, we may have to do that for a little bit. But
mm.
at the same time, that child that's being homeschooled shouldn't be sitting in front of the computer all the time.
Yeah.
They should be outside experiencing things, being, getting that nature exposure, even if they're not going to school.
Mm. And so then the proactive piece, we now know particular. So actually, no, you said babies aren't going to get it. Is that because they're not up to the straw that broke the camel's back moment? And it
Yes,
actually
that's part of
takes,
it.
yeah,
Yes,
okay.
it takes time and repeated exposures.
Mm-hmm.
We and especially those that are breastfed still have mom's immunity. So they're
Mm,
more protected. But even without breastfeeding, they're definitely protected in the first year of life. And
okay.
so far, I have no knowledge of any reports in the literature or otherwise of any children that young. The youngest I've ever seen is about 21 months. And they
Wow.
had
Okay.
older siblings and were getting exposed to strep and other infections quite a bit.
Mm-hmm.
But in general, either because of mother's immunity, they haven't been exposed enough, or that their immune systems haven't been, their immune and detoxification systems haven't been degraded enough. I
Yeah.
mean, we're also seeing this going to the other end of the spectrum, although the P in PANS and PANDAS is pediatric, we're
Mm,
also seeing this in much older adolescents and young adults. And that is also one, we live in a much more toxic world.
yeah.
The glyphosates you mentioned in the parks, but also the things in our food, the dyes, the antibiotics, the all of the toxins, the mold, et cetera, that we're exposed to are breaking down that blood-brain barrier more and more. And so
Mm,
it's not closing as it used to at 13 or 18 or 21. And that's one reason more and more older people are getting this disease. The second
mm-hmm.
reason is it was undertreated, untreated, mistreated, misdiagnosed earlier. And so it's been lingering or smoldering. And then a trigger happened, like for many of my patients that are young adults now, COVID. And they
Mm,
had been doing well for years, but COVID reactivated their tick-borne disease, their Borrelia, Bartonella, Babesia, their EBV or other
mm,
viruses that they had when they were 13, but really was dormant. Think about cold sores.
yeah.
You get them when you're under stress.
Mm-hmm.
Well, that's a dormant virus, and it comes back when there's a new stressor. But if none of that has been treated well, then As an adult, you can get it. It can still be treated.
Mm.
Absolutely. But it's a marathon, and much more of a marathon the older you get,
Yeah. And I'd
when
imagine a
those
lot
are
of
missed.
people waste years in psychiatric care instead of
Absolutely.
pediatric care.
Yeah. Yeah.
Mm.
And there was a wonderful study out of Denmark of 7 million people showing that 75% of those with psychiatric illness had tick-borne disease in the background.
Wow.
Yeah. Yeah. And a psychiatrist I work with, in her practice, 85% of those that come in for anxiety, depression, bipolar, even schizophrenia,
Mm.
tick-borne disease is in the background and was missed.
Yeah. And I mean, we have so much gut microbia
Yeah.
information now to literally link certain bug overgrowths to certain presentations. And it feels like, one of my frustrations, Nancy, is that it still feels like so many people don't even realize this kind of care exists. But B, when they do, it's so expensive.
I know.
How do we I'm not trying to say that doctors shouldn't be charging what they charge, because I mean, you do so many decades of study to stay at the forefront of everything. And it's not that. It's more about access, I think, is a real issue for so many people.
Yeah. And in so many ways we're trying.
Mm,
We're trying to get more and more practitioners to understand this so they can at least start an antibiotic if that's what the child needs.
mm,
And we're trying to provide care through other means.
yeah,
It's why I wrote the book. It's why I did an
yeah,
audiobook. It's why I started a podcast, to try to get the information out there in lots of different ways so that people can at least be aware of it and start to treat it.
mm,
There are a lot of foundations that are providing grants to people. There are a lot of supplements that are very inexpensive, and herbs. There are a lot of companies that are trying to provide free herbs for families that need them.
yeah,
But it is very expensive. And when you're already talking about the overwhelming nature of the disease, maybe you got mold and you got to remediate that in your
mm,
house. But I start with simple things. I start
yeah,
with, okay, everybody talks about biohacking. Let's go get the red light therapy and the HBOT and the sauna. And those are all great. I'm not demeaning them at all. But let's just get outside. Let's
mm,
get good sleeping. Okay. Let's get good eating. And we can start that as babies. When we feed our children rice cereal and fruit, we're feeding the negative microbes, the bad flora. When we
mm.
feed them avocados and vegetables and proteins, we're starting out a better milieu. But you can still do that when your child's 7. It's a little harder when they're 17, but
Yeah.
but
That's a very
believe me.
common little side comment
Yeah,
from
yeah.
all the doctors that I interview. Well, I got a teenager, and so we've kind of had to get a bit more relaxed. And I think we have to stay real about that so people don't think, oh my God, it's all falling to crap because now they eat,
Exactly.
fast food after school with their friends. It's not. Just
Right.
focus on the bookends, what you can do in the home.
Exactly. And
Mm,
also make a contract with the kid. Find
mm,
one thing, we have a 30-page questionnaire people have to fill out before they come to see us. But I figure out in the diet, they're not getting protein in the morning. They need protein.
mm,
Let's talk to the kid. All right, how do you want to get protein in? Well, I'll have a steak. All right, can you afford a steak in the morning? Give them a steak. I don't care. Doesn't have to be
mm,
a breakfast food or a protein bar or a smoothie or something. One thing. Or they're going out with friends a lot and getting a ton of fast food. Well, could you get the burger with more meat and less bun? You know,
mm.
do it that way. Could you, all right, you're not going to get the salad. I get it. But when you come home, could you have a vegetable instead,
Yeah, exactly.
rather than the
Yeah.
carb?
One of the things I did with my son is we actually went to a food court. I said, I know
Yeah,
you're going to be going to food courts. So let's actually go to one and think about what the most fun options are for you that also mean you're not going to crash an hour afterwards and not be able to
exactly.
concentrate in class. So we came to like a burrito bowl that's not
Exactly.
wrapped in a 19 ingredient kind of bread wrap.
Right.
And so that has a bit of salad in it. It's a bit more kind of varied. And you can always find something that's going to be better
Exactly.
that still meets the I want to be like my friends.
Right. Exactly.
Mm.
Yeah. We did the same thing, and
Mm.
my son eats Chipotle almost every
Yeah,
day. But
yeah.
at least it's a little bit better than,
Yeah.
McDonald's, and sorry if anybody is
No
hype on those,
judgment.
but
No judgment.
exactly,
Yeah.
no judgment whatsoever.
Yeah. But you mentioned protein there, Nancy. And one of the things that a lot of families struggle with is at the breakfast table, the inclination towards lots of sort of bread and cereals. And that is a real transition piece, a real fight for a lot of
Yeah.
families. What have you found to be the most successful come on the journey kind of
Right. So what I
conversation
first
pieces?
try to do is figure out, would they add a nut butter to the bread, the pancake, the waffle, the carb?
Mm,
It can be sunflower butter, it can be cashew butter, it can be peanut butter if they're not allergic. Okay, they won't do that. All right, would they have a piece of bacon, nitrate-free bacon? Would they have an egg in any different form? Would they have a smoothie with it? Trying to put any carb together with a protein. Then, if
mm,
they only will have the cereal, there are actually several decent protein powders out there that you can add. The other one, blackstrap molasses. A
mm.
lot of kids don't mind that taste. You could dip, the waffle or the bread into that. And I also think making it fun. We often talk about upside down day.
Mm,
We're going to have our cereal at dinner time, but
yeah.
we're going to have dinner for breakfast. And kids think that's so funny. And if mom and dad join in and all of that, so any of those ways can help, but try not to think just about breakfast foods. Try to
Mm.
think about other foods or one protein that you can add to something that they're already eating.
And why is protein so impactful for this group?
Right. It counteracts the effects of the carbs, but especially it helps to feed the brain. It
Mm,
helps to coat, in some degree, the myelin sheaths, and it provides the fuel that the brain needs when it's been otherwise depleted by the fight of the tick-borne diseases or the strep or anything else.
yeah.
And so protein really helps them to think better, to learn better. And, the other thing is that many of these children have secondary deficiencies.
Hmm.
They have this disease, but then they also have zinc deficiency, vitamin D deficiency, iron deficiency. So the protein is very important for two of those, the zinc and the iron.
Yeah. Okay. And where are we on fat and how much we should bring in of that for this group or even generally as a preventative?
We are not getting enough fat.
Mm.
No way. And our kids especially. And I really, I think one of the things one of my colleagues, Dr. Jim Greenblatt, talks a lot about is low cholesterol. Many of our children with autism, as well as our children with PANS and PANDAS, have low cholesterols. That's a
Wow.
sign they're not getting enough fats. And that has been shown in studies to exacerbate psychiatric illness, to exacerbate anxiety and aggression. So we really want those good oils. And I'm not talking about safflower, canola, the light oils, but your good extra virgin olive oil, your good coconut oils, your macadamia nut oil, your oils that are really rich. And then often that's not even enough. Yes, we want to put that into our diets and have as much as we can, but it also may need to be supplemented. Essential fatty acids,
Mm. And
cod
would
liver
we do
oil.
a complex or do you favor EPA or DHA for the brain aspect, the neuroinflammation?
Yeah, so for the younger kids, I favor DHA. But
Mm.
when they're older, school age and up, I still want DHA, but I want EPA to DHA to GLA in more of a 3-to-2-to-1 ratio.
Okay.
Now remember, GLA is an omega-6. You don't need as much of that. You really need the omega-3s, your EPA, and your DHA.
Mm.
DHA is great for the brain, but I don't want people to overload on that in our older kids and really want to balance with the EPA.
Okay, great. And in terms of proactivity, you mentioned that 2-year-old who takes an antibiotic by accident and then it kind of addresses something, but we haven't caught it yet. And so you can still get pandas. I get that. But what are we looking to catch? Like when you have a 2-year-old, let's say at home, or a 4-year-old, or whatever, the youngest, let's call it,
Yep.
and the older kid gets a strep infection, raging case of tonsillitis, what are we looking to be proactive on when an infection hits to ensure we're not creating a layered buildup to one of these sorts of events?
Right. And that's where I will use herbals or nutraceuticals to
Mm,
keep everybody healthier.
yeah.
Simple things like elderberry,
Mm.
feverfew, turmeric. I recently on my podcast had a woman who did her PhD in turmeric. Like her
Oh,
whole
yeah.
PhD was turmeric.
Was that
And
Shivani? I think
yes,
Shivani Gupta.
yes,
Yeah, she's
yes,
fabulous. Yeah,
yes.
I
It,
had her
it was
too.
a
Yeah,
great
yeah.
conversation.
Mm,
But I think that adding those for a period of time, maybe for the whole winter, as kids are getting repeatedly sick, can keep the raging fire of inflammation down. Allow the normal smoldering, campfire. Inflammation is not all bad.
yeah,
We need some amount of
it's
inflammation to
useful.
fight infection. It's
Mm,
useful. Don't think inflammation is all bad, but it's when it goes from that small campfire of inflammation to the raging wildfire.
mm,
That's what we've got to keep down. So it's really about in that child that's sick, but also the other family members and the younger kids, having them on those sorts of things, good oils and some type of herb like turmeric or one of the other ones.
okay, great. So, would you call that useful practice like year round, or are we just waiting until someone's sick in the family?
It depends on your tendency as a family. If
Okay.
you're a really healthy family, you may have an overactive immune system. And otherwise, you
Mm,
may want to be calming things down a little bit. You may want to think about an herbal adaptogen like ashwagandha, holy basil, saffron, something like that in a family that's never getting sick. But a family that's been through a few winters of everybody being sick, absolutely throughout the winter. Most
okay.
of these well, in the US, most of these infections are September to May, because that's our,
It's a longer
fall.
window of coolness and
Yeah,
yeah.
exactly.
Mm,
But in that real infectious time when everybody's more in close quarters, it's colder, that sort of thing, I'm fine doing it for several months as a preventive agent. But certainly when anybody gets sick, then adding it and continuing it for at least a couple of weeks, not just for the couple of days somebody's sick, but for a couple of weeks, to give that immune system the extra support to try to help them feel better uh,
yeah.
for the longer term.
Amazing. And then when we talk about ticks and tick bites, that's obviously very specific to the person. You're not catching Borrelia,
Right,
or maybe
right.
you can. I'm not the doctor here.
Well, Bartonella is one you can get from many different sources.
Okay.
Lice, fleas,
Mm,
cat saliva, cat scratches, dogs that have been scratched or infected by a cat, and gestationally. If you as
yeah.
a mom have worried you have tick-borne disease, it is possible to pass Borrelia, which is what we call Lyme, Bartonella through the placenta, and the
Hmm.
baby can get it that way. But yes, the most common way to get tick-borne diseases is from ticks.
Yeah.
But most ticks that can affect are the size of a poppy seed. So I'm
Hmm.
always happier when I see one. But to prevent the things that are very good, like Picardin, which is in a product like Sawyer, which is one of them, is a very good, better than DEET, which is much more toxic, very good to spray on clothes. I often will soak my clothes in something like that before I go out. My socks, my handkerchief that I may wear around my neck, thinking that where the ticks come the most are the ankles, around here, the warm areas, behind the knees. So check those areas specifically and have those areas have extra. If you don't want to use the picaridin, then citronella, garlic, cilantro, those are great. Soaking them in those, that helps to keep the ticks away. The other thing, if you have a lawn, wood chips. 3 feet of wood chips around the exterior of the property keeps the things like field mice, which actually take it from the deer and bring it in. That keeps that from coming onto your lawn.
Wow. So do you mean
Yeah.
like we call that mulch? I think like just
Yeah,
a
like
whole bunch
mulch.
of, yeah,
Yeah.
okay.
Yeah, because it just is that extra barrier to your yard for the field mice and ticks that are carried through there. So they sort of get stuck in that area. So
Mm-hmm.
that can be very helpful. There are a lot of natural traps that could be very helpful. And then wearing the things that I talked about and doing tick checks.
Yeah.
After you've been out, taking the shower, taking the bath, really doing the tick checks. And there are very natural agents that if you find a tick bite, that you can use either topically or orally, homeopathically, naturally, that may help to prevent that. I do
Mm-hmm.
recommend that if you get a tick bite and you see the tick, that you do send it to be tested. And I
Okay.
apologize, I'm not sure, and you may know where you can send the ticks locally. I would check tickreport.com and see if they know local places.
Mm-hmm.
I send all my ticks to tickreport.com now, and there are a
Yeah.
couple others very similar to that. But knowing, in our area of the United States, 41% of the ticks carry Borrelia, Bartonella, and Babesia, all
Oh,
three.
wow. That's a
And
lot.
so even if you're treating and you get a dose of doxycycline, you're missing the other ones. So again, why I like herbals, why I like homeopathic remedies, things that naturally treat several things at once, as opposed to throwing one antibiotic that'll only treat Borrelia on there.
Right. So doxycycline only addresses Borrelia.
Little bit Bartonella, but you can never treat Bartonella with just doxycycline alone.
Mm-hmm.
But
And
yeah,
so
really
what
just Borrelia.
and are there other antibiotics, or is this really only able to be addressed homeopathically or herbally?
There are other antibiotics, absolutely.
Mm.
With Bartonella, it usually takes at least 2, sometimes 3, and with
Mm.
Babesia, it takes at least 2, sometimes
Wow.
3. But if a child just gets a tick bite, I'm not going to put him on 3 antibiotics to
Mm.
prevent, but I might use like 30C of ledum, which is a homeopathic remedy, or a combination of herbs till I get the tick report back, like
Mm.
cat's claw and Japanese knotweed and hatunia, things like that are very safe and can be effective for all three. Cryptolepis, if I didn't mention it.
Nope. Thank
That's
you.
the other one. Thank you. Then you're covered while you're waiting to see if the tick has it, or you're safe in a child if you couldn't check the tick in treating that way until you can see a practitioner who may be knowledgeable in it. And there are a lot of them.
Okay, great. That is such useful information because I think a lot of the worry and panic happens because we actually just don't know what to do when it happens.
Yeah,
And
exactly.
where are we at with the body being tested on tick-borne diseases? Because you see a lot of stuff online, a lot of doctors just completely poo-poo all of the testing and say, be guided by your patient's symptoms. But others, like some of the testing that's recommended is super expensive.
Well, this
Um,
is where we come to where we don't want to make the families who can't afford it pay for all these expensive tests.
yeah,
So
exactly.
it
Because that would be
is
better spent on let's really listen, let's match it to the environmental incident, and let's use that money to treat.
exactly. And as I'm mentoring more, my mentoring patients, I cannot prescribe. I cannot order labs. So if I'm mentoring them, then I'm going all on the clinical symptoms. And I just spoke about something called Alice in Wonderland syndrome, like where you go
Ooh.
down the rabbit hole and
Oh,
everything
yeah.
looks
Yep.
different.
Mm-hmm.
And 6 kids I have now, all mentoring clients, none of which were tested, all I thought had babesia, had all the symptoms of babesia, treated them herbally for babesia, and their Alice in Wonderland syndrome symptoms went away. And some of them had it for 3, 5 years before I had seen them. Just herbs.
Wow.
So it is possible. So number one, many doctors poo-poo Lyme disease because it can't be picked up adequately on a conventional lab test. Very few tests pick up anything. And most of the tests that are done were built to be done for surveillance, not for diagnosis. So that two-tier test a lot of doctors talk about, getting a screen, and then only if the screen is positive, getting more immunoblot or Western blot testing. That is totally inaccurate. So we don't want to use that. And the testing from conventional labs for Bartonella and Babesia also very hard because these are germs that don't really want to make you sick, but they're loving life inside your body. They want to go dormant, like that herpes virus in your cold sore. These germs also go deep within biofilm or within cells or within other germs within your body and are hard to find. So that's why the specialty tests, if you're going to go looking, are important, but are very expensive. And don't get the less expensive specialty test because usually it doesn't have external validation studies. And I won't name names, don't want to offend anybody, but look for really the gold standards if you do have the money to test. But otherwise, I mean, thinking about symptoms, when I think about Bartonella, I'm looking for stretch marks that don't follow usual lines. They're more vertical or horizontal. And on weird areas, they could be on the forehead, behind the neck, on the knee. I've had it. I remember one of the first times I came to Australia, I remember one of the docs I was mentoring said, "We don't have Lyme disease here." And I said, "Yeah, you do." Now, this was 20 years ago. She goes, "No, we
Yeah.
don't." I said, "Yeah, you do." Next kid that comes in, he was having anxiety and rage, which are two of the big symptoms with Bartonella. And I said, "He has Bartonella." And she goes, "No, he doesn't." And I said, "So what are your other symptoms?" And he said, "Well, I ball up my socks in my shoes because the soles of my feet hurt." Bartonella symptom. Like, okay, good, good. And any rash, and he said, "I got these weird marks," and he put up his shirt, and there, these blanching stretch marks, and they blanch, meaning when you press on them, the color changes. Stretch marks from having a baby or changing weight or stress do not blanch. And they also follow dermal lines, sort of
Yeah,
like
yeah.
this, as opposed to being vertical or horizontal. So anyway, that kid had Bartonella. We treated him. His anxiety and rage went away. It wasn't sensory. It wasn't just behavioral. It was
Wow.
Bartonella.
And
And
was
with
there, if we think about the three-stooled approach, what was it for him? So that we can
yeah,
just paint the picture of a case.
exactly. So we put him on Japanese knotweed, and cat's claw as herbs to treat the Bartonella. We put him on Pectisol, which is a brand of modified citrus pectin, but it could have been any modified citrus pectin. That is a good binder to bind
Yeah.
things out. It also decreases the inflammation that's caused by tick-borne diseases, and it helps gut health. And we also put him on another immune modulating agent. And this kid, he didn't really like pills. He preferred liquid. So we put him on a liquid turmeric. And then for his symptoms, because he was so anxious, we added in that particular kid, I think, now I'm thinking back, I think we added ashwagandha and that worked. But there's so many herbs and supplements we can use to decrease anxiety. But I often think about herbal adaptogens first when it's anxiety or rage. So that's what we did for him.
Wow.
Now
And
with
so there
the
was no need for antibiotics in that case.
No, didn't
No.
use an antibiotic, didn't do a test. I said, "Let's try it 3 months. Let's try it and see." And he was better in 3 months. We did the treatment for about 9 months total. And that's the minimum it usually takes. But within 3 months, he was better. And nine
Amazing.
months, totally better.
And that protein, fat lift, carbohydrate down was
Absolutely.
part of
Same
it.
thing. We tried to do that. Absolutely. Now, this was a somewhat older kid, so he wasn't willing to do everything, but we got protein in the morning. We got him to add more oils. He actually liked salads, so we got him to make his salads more oily. We
Mm.
added more oil to the salads, and he was able to do that. And then his mom did it more in cooking. He wasn't willing to, he didn't like the taste of any fish oils or anything like that, so he wasn't willing to do that. But we tried through diet.
Yeah. And it's about finding what's going to work for that
Yeah,
patient. Yeah.
yeah,
So important.
absolutely. Yeah.
Mm.
So, but there are so many ways to do it. And just, you know, I see myself as a family's GPS,
Mm.
meaning that I'm helping them find the right route to go down.
Yeah.
I may be a pushy GPS sometimes because I think this route is the right way, but
Mm.
they're still driving the car.
Yeah.
And they're living on the front line. So we have to work together with the family, the parents, and the child to figure out what will work best for them, taste wise, financially, what the trigger I think it is that may work best, and try to find the best interventions for each family.
Incredible. And often, and I think you actually alluded to this right when we started, Nancy, often there is a parent champion and a parent skeptic.
Oh, yes.
How can we best move forward in these situations? What have you found successful there?
Well, not to be sexist about it, but many of the fathers actually like sports. And
Mm.
I'm a huge sports person. So I actually try to connect with the dad to find something that we can agree on. And I
Mm.
try to find something, even though I totally believe the mom, I try to help the dad feel like he's involved also.
Yeah.
Help him to be okay. Tell some jokes. I'm not the funniest person in the world, but I usually can find one joke or another a dad will
Yeah.
like, you know, but try to find some common ground. And often it's more the mom wants to do 10 things and the dad wants to do one or
Mm.
none
Mm.
or take away 10. And I try to say to the mom, let's not do 10, let's do 5. And I try to say to the dad, let's find 3 that you like and let's meet somewhere in there.
Mm.
And then I try to explain it and why I'm doing it, what they're seeing in their kid. And that's really important with
Yeah.
the symptoms, to find the one that's affecting the family the most. Like if nobody's sleeping in the family, I'm going to treat sleep first. No matter what
Mm-hmm.
else is going on, I'm going to get everybody sleeping. And that helps everybody. If it's the kid's tics, I can't stand that he asked me 20 questions. I'll address that and find a remedy for the OCD that they may be having. But I really try to get both of them to come and meet in the middle somewhere. And I think that's
Yeah.
so important for all of us.
Mm.
Nobody, one of the slides I often use in my talks is follow those who seek the truth, but flee from those who have found it. None of us have all the information.
Oh
No
my
mom,
gosh, wait.
no
We need
doctor.
we need to give that space. There's always a moment in every show that needs space and landing. Say it again slow. It's beautiful.
Follow those who seek the truth, but flee from those who have found it. Nobody has all the answers, certainly not for your child. You know more about your child than I do. Even if I've known you for 20 years, you still know more about your own child. But still, you don't have all the answers. That child may not be, that's 17 or 26 now, like mine, may not be telling you everything.
Yeah.
You don't have all the answers. I don't have all the answers, but no practitioner does, no matter how wonderful they are. And all of us as practitioners and as human beings should keep looking, keep searching for the answers. The other thing my mentor always said to me is, have we done enough for this child? And
Oh, I love
unless the
that.
child is fully better, the answer is no.
Mm.
So I am always going to be looking. I am always going to be open to somebody else's suggestion. Now, I may tell you why I don't think, as your GPS, that's the best route for your child. It may have worked for your neighbor's child, but here's where your child is different. But if it's safe and it could be effective, I think it's worth trying because then we all find out together. Yeah, feverfew is really good in decreasing my anxiety. You told me ashwagandha would work, and that did nothing. I tried this
Mm,
feverfew and it was amazing. Okay, now I learned something. All right, this kind of kid is going to do better with this. But if a doctor says to you, there's nothing you can do about autism, save your money and they're going to need to go in an institution or special school or whatever it is, or PANS PANDAS doesn't exist, run the other way.
mm.
They have to at least be open. They don't need to be an expert about it. They just need to listen to you tell the symptoms. And heck, you could go into ChatGPT or AI and they'll tell you what you have. And it does come up now, that when you have an abrupt onset of symptoms, your doctor can find that if they just listen to the symptoms and what's going on for your child, and they'll find the answers.
Yeah, I love that. And can we just unpack a little bit the piece on autism being very real and is very lifelong?
Yeah,
It's a neurotype for some families. For some, it's a collection of symptoms
right.
that perhaps it isn't autism. Is that what I'm hearing from what you're saying?
Yeah, so in
Because I'm
autism,
just really, I guess what I want to unpack before you go in
yeah,
great detail is there's a lot of like treat, cure, your child is a problem, you've got to fix it, this
I definitely want to
obsession
address
with
that.
this
Yes,
problem that you have.
right.
And I think there is just so much beauty in every human to be discovered.
Absolutely. I have another
And
great one for that one.
yeah.
So,
And so,
yeah,
like, there are symptom pictures, there are exacerbations, there is who you are, and there is being unapologetic about that. Like,
yeah,
how do we navigate the kind of language that allows space for people to not feel like you're trying to chase them down as a problem,
yeah,
while also recognizing there is so much that can be done to support easier, happier living?
yeah, yeah. So I think so much of the time, as doctors, practitioners, and as parents, we want to fix our kids.
Mm,
We want to make them better, right away. And people talk about peeling back the layers of an onion. I prefer to use a gift analogy. So many of our children, for instance, those with autism, may be wrapped in 9 layers of wrapping paper.
mm,
And it is our job to unwrap those layers to get to the true gift inside. But every child, every person is a gift, no matter where they are in the journey. And I'm not trying to fix them or change them, especially our neurodivergent people. That is not what we're trying to do.
mm,
I want to help each person, each child, reach their fullest potential. That may mean, look, you have autism, but you also are vitamin D deficient. You take your vitamin D, you may not get as sick. You may not have the autoimmune reactions, the rashes that you were having. Your mood may be better. You're zinc
mm,
deficient. You may have this infection. And some of our children with autism actually may have been misdiagnosed and it be PANS or PANDAS. I
mm.
just want to unpack all these layers. I'm great if you want to keep all your layers. I'm just here to help you figure out what those layers are for you or your child and how we can best help you be the healthiest you can be. That
Mm,
doesn't mean we have to fix everything and take everything away. We're not,
yes.
we don't want to do that. And I don't think we should do that. And
Mm,
also, I think it's really important to remember that if we know one child with autism or one child with PANS PANDAS, we know one child
mm,
with that. Everybody's different. These are constellations of symptoms, but we've got to look at the child underneath. We've got to look at what is this child dealing with. There are some children with autism who are totally non-speaking. That is very frustrating. That doesn't mean they're not intelligent. It doesn't mean that they're not able to communicate. They just may have a misconnection between their brain and their mouth and it can't come out in words. But they're in there and they can communicate through spelling, etc. So, you know, everybody needs to be met where they are. The child that's not eating but refuses to change anything, the child that's anxious as can be but likes their anxiety or likes a little bit of their OCD. I like some of my OCD. It makes me a better clinician. Don't
Yeah.
try to take it out of me.
Yeah, agree.
Know
Like
your
with
child.
ADHD, I'm like, I
Yeah.
spot patterns and see things that like none of my friends see. And I wouldn't want that taken away from me for the world.
Absolutely. But
Mm,
own your gifts,
mm.
own your challenges, make the most of both ends of it. But in the same token, if there's something underneath that's really driving more negative symptoms, that's what I want to find.
I
That's
love
what I
that,
want to
Nancy.
help you get better.
I feel like everyone can meet there. I'm all about the overlaps. And I think if you would get a regular kid, well, gosh, that's even the wrong language. That's
Right,
so the wrong
exactly.
language. A kid who's presenting societally typically, like no one's
Correct.
red flagging or thinking, gosh, there's a problem here. What we need a diagnosis. If we've got a kid like that, but they're always sniffling and they seem to be getting sick like multiple times every winter, you would test that kid for vitamin D and zinc. It
Right.
is not a bad thing to do those very same investigations on a neurodivergent diagnosed kid
Right.
just because, hey, you're trying to question who they are and you're trying to fix them. No, it's
No.
actually exactly what you said, which is let's be the best versions of ourselves that we
Yeah.
can be. I love that we've arrived here. Brilliant. So
Yeah.
good. There's space for everyone there.
Yeah, exactly.
Yeah, yeah.
Exactly.
Mm,
But I say that to parents also because I think we as parents want the best for our children, but in doing that, we sometimes want things for them that they may not want. We as parents also have to meet our children where they are. We can tell them, again, in my GPS analogy, we can tell them, this is a road that might be worth looking at, but still we have to honor who they are as individuals. Neurotypical, neurodivergent, PANS, PANDAS, whatever it is.
so, so important, so crucial. And so I guess the last thing I want to ask is the mental well-being and support piece in the family setting at home. Yes, challenges happening, working on it with the doc. um how actually sleep, especially you said I just want to get the whole family sleeping. That journey can be one of like you can make it a team challenge, I'd imagine, like let's all work together on this, because the exhaustion is such a huge piece of the mental health piece then falling apart.
Yeah, yeah.
Mm,
And it is so important to talk to the families about what their biggest challenges are. It may
mm,
not be what looked like what it was on the report that they sent.
yeah.
May not be what you think is important, but meet them where they are there and get those biggest symptoms calm down a bit at least.
Mm,
And it may be different for each member of the family. Nobody's sleeping. Well, dad's not sleeping because he sleeps better when mom's in the bed, but mom's in the bed with the 5-year-old that is so anxious he can't get to sleep. And the 5-year-old is screaming out at night. So the 7-year-old isn't sleeping because he gets woken up by that. So each thing may be a little bit different. Okay,
mm,
dad, how important it is for mom to be there. Okay, it's really important. That's got to be there. All right,
mm.
now we got to figure out how to help the 5-year-old feel safer. Would you be okay if for a while the 5-year-old slept in a sleeping bag on the floor in your bedroom? It's different for every family than giving the melatonin or the valerian or some other magnesium, whatever it may be, to help that child that's so anxious get to sleep. And then have the white noise machine on so the 7-year-old isn't waking up. You are treating the whole family and trying to come up with solutions, none of which are breaking the bank, but all
Yeah,
of which
yeah.
may be meeting them to help them where they are.
And I love that, that investigative approach to like, what is the most important place to start that's setting off a chain of dominoes? Because, get more sleep is like one of those victim blaming kind of statements we hear so often on the internet and health. And it's like, okay, I'm a 49-year-old woman. I want to punch you right now for saying that to me.
I know.
I would imagine a parent of a PANS PANDAS child would hear that statement and want to punch someone. Do you think I don't want more sleep? Do you think I don't want to prioritize it? So I think that approach is really, I haven't heard that one before, Nancy, put in that kind of detective-like way.
Yeah.
Very individual exploration of each person's sleep experience and what's causing a domino effect.
Right. And although we can talk about sleep hygiene and having a cold room and a heavy blanket and no electronics, and those are all great, but that may not work for that person. What they actually need is to listen to their audiobook or listen to an app on their phone to bring down that anxiety. Or there's so many different ways to do it. But if you're just putting, as I call conventional medicine, prescription pad medicine on it, even in a functional medicine point of view, you may not be using your prescription pad, but you're still just trying to put the nutraceutical or the herb on it. You're missing that what's really going on for that family.
Wow, Nancy. So you're so amazing. So it's been such a pleasure to spend this hour with you. So a fountain of information. And I'm so grateful you've written the book because that makes the work that you do so much more accessible for people around the world. And we'll be seeing you shortly if people are listening live right now in Sydney at the Mind Foundation conference. So that will be awesome.
Yes.
Do you have any parting words, anything that we didn't cover that you would just love to add in that could be really powerful and impactful for families? I don't want to put tons of pressure on you here right now.
No.
I just always feel like there's that extra, we didn't talk about that. So any final things to say?
I think, number one, don't think that because your child has had several triggers, we've talked about tick-borne disease and mold and mycoplasma and strep, that they're worse. This is an immune illness. The immune system is dysregulated. That is not working the way it should, and it is attacking the brain rather than attacking the germ. But it will do that with any germ, anything that it comes, and including stress. So don't look at it as my child is so much worse. No, we just have to go back, find all the little triggers, but treat the immune system. And no matter how bad it is, there is always hope. It's not false hope, but there is hope. And it often seems like you can't get ahead of it, but just think about taking one step forward. You may take 2 steps back, but just the next day get up and take another 1 step forward. Do one thing. Don't try to do 10, just do one. And that old adage of put your oxygen mask on first is very true. It's a silly phrase, but the meaning behind it is don't forget to take care of you, even if it's taking one more breath before you open your mouth, or one more breath before you take care of the next child, or take 5 more seconds in that shower and end it with a cold shower. That's a really good one. That's helped me a lot. One thing that you can do for you, because our children are very symbiotic with us, and helping to heal ourselves, decrease our own anxiety, agitation, and all of that will in many ways help us to be more available to our children, but also help them to heal too.
Be a good co-regulator.
Yep.
Yeah. Thanks so much, Nancy.
Thank you. Really appreciate it.
I hope you loved today's show as much as I loved bringing it to you. I want to remind you that if you are someone who craves a low tox community that is judgment free, full of empowerment, has health professionals and building health professionals that can support you, as well as me in there answering questions multiple times a week, I want to invite you to join the Low Tox Club. For the price of less than a cup of coffee a month, you have an annual membership for $49 Australian, so it's about $30 US US or Euro, that allows you to have a member masterclass every single month with a health professional or global expert from the podcast, where we have them to ourselves for an hour to ask questions and deep dive further. You have the beautiful supportive chat group. You have Q&As with me answering questions. We read books and talk about them, and a whole bunch more. You can head to lowtoxlife.com, hit the explore tab, and join the club is the very first option on that list. Of course, we have over 10 evergreen courses that you can jump into anytime, whether it's navigating everyday low tox swaps with our Go Low Tox signature course, whether you have kids and you're wanting to know how to best support them with our Low Tox Kids course, whether you're planning a family and looking at a healthy low tox preconception journey, reducing inflammation, especially the chronic kind, with our Inflammation Ninja course, many other courses. You can again head to lowtoxlife.com, hit the courses tab, and you'll see all of the options, which includes a business course, my Low Tox Method program. A lot of people don't know, but I was doing a lot before starting Low Tox Life in 2009, and I was a business consultant across hospitality, health, retail, and cosmetics. I have been in business consulting for a very long time, so I absolutely adore helping people move into the low tox space or develop their low tox businesses. So that's a way I can support you. And then, of course, there's our wonderful social media communities at Low Tox Life on Instagram, and of course, the website with over 250 gluten-free recipes, blogs, downloadable PDFs to help you navigate wanting to get rid of synthetic fragrances in your school or office. I could go on. So head to lowtoxlife.com, see what takes your interest or fancy, and thank you so much for being a part of our podcast community. I love reading your reviews. I appreciate every follow and subscribe, and I want to just remind you to finish off that if there's anything you heard that you found interesting from a medical or scientific perspective, it is intended as education only. Please always chat to a health professional who knows you and your situation best. I'll see you next week. Bye.